I feel your pain, I feel your pain, I feel your pain, oh, like a runaway train. I feel your tears, I feel your fears, I feel your tears rolling down my cheek. And those dreams that you had.
One of the things that the students have brought is their new perspective and their new way of thinking.
So basically I just want to try to make a positive impact and do the best I can to leave Braddock a little bit better of a place.
So it's been, more than anything, it's been a really huge learning experience being with her through this whole journey.
It's almost like sharpening because of the new perspective, the new diversity of perspectives and of thinking.
Bringing the Gaps has had a foundational, if you will, impact on the rest of my schooling and what I'm about to do.
Their work has been invaluable to us.
It's been so rewarding for us.
I am the Early Head Start Director for the Council of Three Rivers American Indian Center. Almost the entire 20 years that they've been an exception, I have worked with Bridging the Gaps program. We work with prenatal to three-year-old children and their families to get them ready for kindergarten.
So it's one of the many organizations in Pittsburgh that works towards promoting early childhood development and school readiness.
I and my partner served in Clariton at Sister's Place, which was started many years ago by a group of 12 Catholic Sisters organizations to decide to help women who were homeless.
Summer camps are always popular. As Bridging the Gap states, there's always a need for programming for kids whenever school's out. So we usually would have at least 1 or 2 summer camp style sites for folks.
My placement was at Community Human Services, or CHS, and they do quite a few different things.
They have shelters for homeless people, they have shelters for individuals or families in crisis.
And they also have a food pantry in South Oakland.
The organization I'm with is called Sojourner Moms.
Sojourner House is probably the only organization in southwestern Pennsylvania that offers addicted mothers and their children their own apartment and the opportunity to recover from the disease of addiction and to really reunify as a family.
I was posted with Pittsburgh Soccer in the community.
I was placed at BYP, which is the Braddock Youth Project. What we do here is it's kind of a learn and earn program. So they hire usually teenage kids anywhere between the age of 14 to I think the oldest here is 19 years old. So what they do is they are hired actually here, but then they go out into the community and they do basically just try to be community advocates for the city of Braddock. They're trying to change the stipulation of when you see a group of teenagers out in the streets or out, in Braddock, that's like a negative thing. They want to change that perception into being like a more positive aspect.
I was placed at Gwen's Girls, located on the north side. Gwen's Girls was started up by the first Black female commander-in-chief of the Pittsburgh Police Force, and her name was Gwendolyn J. Elliott. And during her time spent in that position, she noticed that there was a deficit in programming, particularly for young adolescent African-American girls in the community. So she started up not only an after-school program, but as well as a summer camp intended to address empowerment topics, trying to just create more activities for young girls in the community.
Last summer, I spent in a pharmacy just kind of doing grunt work, not really being involved with any populations. And Basically this summer I was looking for, I want to like be out in the community, I want to be trying to like be an advocate for change and try to actually feel like I'm being more involved in the community.
I really wanted an intensive sort of service learning opportunity where I would get to be immersed in the community and learn a little bit about the populations, different populations in Pittsburgh, and sort of the different organizations that are available to serve them.
So it's really to get I would say a hands-on opportunity of serving others.
With the Bridging the Gaps program, my idea was to really have more of an experiential experience, if that makes sense. I think it makes a big difference if you're reading about it in the newspaper or a textbook or online compared to actually meeting the people, interacting with them, and seeing what services to people in these situations are actually like.
I think the biggest thing was trying to apply the skills and concepts that I had been learning in class for such an extended period of time. Really trying to gain that skills-based approach and really trying to see how theoretical approaches can be applied in the community.
The main thing was to get out of the ivory tower and go out into the community and interact with the people that we hope to serve one day.
Well, I first applied to Bridging the Gaps thinking that it would be a great opportunity for me to learn a little more about all the different organizations and populations, vulnerable populations in Pittsburgh. I think that what I'm actually going to get out of it, it's a little more. I get all the experience of being able to talk to all the residents and all the people that are receiving these services. I get the experience, I get the really good network of people, all the interns, we get to know each other.
We have had some absolutely fantastic interns over the years. They have done us quite the service. They have developed a number of curriculums, a number of newsletters, a whole pregnancy curriculum, and a parent handbook about diseases and immunizations and dental health. The depth of what they do is really incredible. It's not a cursory, it's really in-depth detail.
The fence behind us is a sampling of the many mothers and children that have come through Sojourner House. Started 10 years ago with the Bridging the Gaps student program. There were 2 students, and they wanted to do something that they could leave behind that would have a lasting impression on not just Sojourner House, but for the whole community. It's nice to put their handprints there, and it's a good reminder that every journey of recovery does start with one step.
So after about 3 weeks of really just trying to do some observations and really get a sense of the culture and feel of the community site, we decided, based in collaboration with the organization leaders, to help integrate a curriculum addressing health and wellness topics.
Our first year, the students left a book for art therapy, and what they found was the women that they worked with in our transitional housing program and in our supportive housing program. Some are severely mentally ill. Most of them certainly come from a lot of trauma, and so when they did the art therapy with the women, they really responded, and so the interns put together a book. And it was wonderful, and the staff are still using it today.
We put together some health education material on healthy eating. We also did, as a main project, we helped build a garden.
So we came up with an early Head Start health and safety handbook, which provided information about the program in a way that was accessible to the population.
We developed a photo journaling project. It started out as a photo voice project, and it kind of evolved as the weeks went on. We were able to give camera phones to participants, and we gave them the question, what influences what you eat, as well as how has the food pantry changed, or how does it influence what you eat?
So our project mentors were very clear as to what they expected from us from day one. So they wanted a curriculum that could be taught along with soccer. So we developed a curriculum which included health and manners and basic personality development along with soccer. And those two had to come together, which was a delicate balance at times.
The project that we're looking to develop for the Sojourner Moms program is a binder and a presentation that will be given to the women about certain mental health issues. So we're covering depression, anxiety, PTSD.
We actually got the opportunity to interview a couple of the youth at Braddock trying to get into BYP. And what we realized is that a lot of these kids weren't necessarily prepared for an interview setting. And that's not their fault, they're young kids. I wasn't prepared for my first interview when I was a teenager. So for like right now we got resume, we got interview skills, we have proper email addresses, how to write a letter of intent, like the difference between a credit card and like a debit card, how to write a check. Just things that they don't teach you necessarily in high school, but you do need to know in order to be like a successful adult.
So the interdisciplinary aspect of the program is like one of my favorite parts. So we worked with all of the schools of health sciences at the University of Pittsburgh. So we had pharmacy, dental, medicine. We had School of Public Health and also School of Social Work. And we would take those students and match them with one another and then match them with a community agency.
I was placed with a student from the School of Public Health.
My partner was from the School of Pharmacy.
So I was paired with a nursing student, which provided a really interesting perspective that I had not originally been exposed to before.
So my partner was actually from the School of Social Work. So she came from a very different perspective in terms of counseling patients, which I wasn't familiar with, and there was a lot to learn from her.
Well, I'm so happy, number one, that I have a partner, and number two, that the person's from a different discipline. The reason why this is so wonderful, I think, is that as a medical student, I certainly have one perspective, maybe a little bit more focused on the biology of what's going on there, but she has perspectives and certainly ideas and potential solutions to problems that I see that I never would have thought of.
It's been pretty great because nurses know a lot. Like they know a lot about a lot of things, so especially anything healthcare related. So she's been a pretty valuable resource for that. And I understand, like they keep on preaching this in school, is the importance of working as a team in like a healthcare setting. So it's nice to practice that and working with Danielle, and we bring different things to the table from our different backgrounds, so we get able to tackle problems better.
And that was great because pharmacy, not wholly clinical, is closer to clinical medicine than what I'm studying. And so it was interesting to kind of get her viewpoint.
We get really mired in the language of the programs that we're in and how to talk about and think about situations based on, you know, that language and that very specific perspective. So it was really amazing to see, for instance, a student from the School of Medicine and a student from the School of Social Work coming together, having a shared experience and then processing it together, each of them having a really different perspective on it. And I think it provided amazing learning opportunities for the students.
You know, when you study different theories, when you study different models, when you study different ways of doing and being, having each of those at the table is just a gift, because I think what we do is we create something organic, and out of that comes something very rare, but it's something that's very healthy. You know, for me, diversity is so important because no one thing or no one type has the answer. We need a diversity of all. And so having that interdisciplinary team of thought, you know, is to me what makes it. It's what makes it, and I know it's what makes us better.
The reflective sessions gave us a chance to meet once a week with our fellow peers.
And usually debrief about our experiences working at our sites.
We've had like a poverty simulation.
We would have a variety of speakers.
We get some didactic time where the director of the program or different guest speakers will come in and talk to us about housing or obesity, or today it was dental care in low-income areas. And so that's been interesting because that's kind of the 30,000 feet up perspective compared to when we're on the sites, which is you're really down in the trenches. And so it's been a nice balance between seeing maybe more the academic, theoretical side, understanding what's going on there, and then also seeing what's happening on a practical level with the people that are being impacted by this.
So that we could really sort of dig deep into, okay, this is what we're learning in the classroom, this is what we're learning in reading these journal articles, this is what we're learning in presentations that are being given to us, and here's the real world, and how do we bring the two together.
Many of the speakers were like renowned in their field, and they gave such excellent advice about advocacy.
Another really interesting part of the talks every week was really trying to learn from the other students who are a part of the program, since each of us were working with very different populations, very different neighborhoods, very different experiences.
It was good to discuss and then have ideas from other members in the Bridging the Gaps in community who could like give you feedback. They're like, oh, that's something that we saw at our side too, this is what we did. So it was good to see that sort of like collaboration between all the sides.
Sometimes, when you have interns, you have students, you really have to motivate them. You really have to be very much involved in their work. But with Bridging the Gaps, they come ready to roll, and I really, really like that.
Because they are such self-starters, my work as a mentor is just that, to mentor them, to make sure they have the right resources, they're pointed in the right direction.
I think the other thing for me that is they come with a sense of commitment. They come with a sense of social justice and change, which is really, really, really important for this kind of work. And I attribute that to what the program director has done with regard to the interviews, their commitment when it comes down to their values, because their values have to transfer over to the work that's being done. I think what stands out for me the most is the level of involvement of Bridging the Gap staff. We've had some absolutely wonderful conversations, and it's really great because we work with people who are at the margins. And so I think that when the students are here, it gives also the women that we serve a different level of care.
Well, I have to say I vividly recall a particular talk we were having with Thistle about what kinds of things you really need to have when going into this experience. And the two main topics that she talked about was having a sense of flexibility as well as a sense of humor. And I feel that those principles have followed me through various different kinds of experiences I've had since then.
What I ended up getting out of it were skills and experiences managing those kinds of sticky situations. So when we're actually working with people on the ground and we're not just studying, populations or like data from some research article, it's a lot more messy. As someone on the administrative team, being able to deal with that appropriately, being able to deal with the realities of our interns themselves, the challenges that are being faced by our community partners, the leadership there, some of the really emotional things that come up when you're dealing with people who are living in these types of situations of poverty and lack of resources and whatnot. So being able to help, one of my favorite parts of it was just learning about all of the awesome organizations we have in the Pittsburgh area. There are just so many people doing good work here.
I think the main thing that has stayed with me, that some of the big problems that we're facing today, like obesity and poverty and racial discrimination, are things that we can't solve by sitting in an office. You have to solve them by being in the community. And especially from being in a medical background, you always think, okay, the patient is sick and we can treat it in the hospital. But like something like childhood obesity, you can't treat it in the hospital. You have to go out into the community. You have to be there day to day with these people in order to address those issues. I think now I'm more aware of the challenges that I would face, and I can be more prepared in addressing them. We do learn from people who have a lot of degrees after their names, and they're here and they're great teachers, but there are people in the community who don't necessarily have that, but they still have so much to teach you. As long as you're receptive to that, they have tons of experience of being there, so that counts for something.
Just simply hearing the stories of the different women that are in the program and hearing about the adversity in their lives, also the triumphs that they've had over beating this disease of addiction, or trying to at least. I would hope that this would generate in me more of a continued sense of empathy towards people in these situations.
knowing that you were there to be able to help someone and seeing it in their faces, like, you know, they come in with a certain expression and then they leave the room smiling or feeling a little better. I think that's one of the most touching things that I've experienced.
How difficult some people's lives are just to, you know, get access to healthcare, get access to food. There's a lot of things that I took for granted coming into this internship, and just in 4 weeks that I've realized that are just like luxuries.
To sum up Bridging the Gaps in one word.
To me, Bridging the Gaps is
serving.
Creativity at its best.
Resilient.
Full contact.
Opportunity.
An incomparable experience, and one that I will never forget.
Life-changing.
Supercalifragilisticexpialidocious.
Revolutionary in the sense that it shows that change is possible, even with small efforts and with a can-do attitude.
To me, Bridging the Gaps is a life-changing experience.
I know the battle's won, but I still gotta fight it. I know the battle's won and I can't deny it. I know the battle's won, but I still gotta fight it.
Was that an okay? That wasn't like breaking your rules too much.
Striking my chest.
I say full contact is kind of like a hyphenated word. Does that work?
I'm just gonna be like, oh no.
I forgot what I was gonna say. I had something.
I'm picking up the truth now.